Question 1. A quality improvement team is starting its first project to reduce patient wait times. What is the most important initial action for the team to take? A. Brainstorm a list of potential solutions. B. Collect data on current wait times. C. Select a team leader to assign tasks. D. Create a clear, measurable problem statement. Answer: D. Create a clear, measurable problem statement. This question tests the foundational first step of any quality improvement project, with the keyword being initial action. A clear, measurable problem statement is the essential starting point because it defines exactly what the team is trying to solve. Without a clear definition, any data collection or brainstorming would lack focus and direction. For example, a good problem statement is: reduce the average waiting room time for scheduled appointments from 45 minutes to 20 minutes within 3 months, which is much better than just saying fix long waits. Always remember to clearly define the problem before you even think about trying to solve it. Question 2. A hospital manager wants to understand the most frequent reasons for patient complaints filed last month. Which quality tool would be most effective for this purpose? A. A control chart. B. A flowchart. C. A Pareto chart. D. A scatter diagram. Answer: C. A Pareto chart. This question tests your knowledge of basic quality tools, focusing on the clue most frequent reasons. A Pareto chart is the best tool because it specifically helps identify the few significant problems that cause the majority of the issues, often called the 80-20 rule. The chart displays reasons in descending order of frequency, making it easy to see where to focus improvement efforts. For instance, a Pareto chart might show that 80% of complaints are related to just 2 issues: communication and billing errors. Think of it this way: a Pareto chart helps you find the biggest bang for your buck by showing which problems will give you the most improvement if you fix them. Question 3. During a root cause analysis, RCA, of a medication error, what is the primary goal of the investigation team? A. To identify the staff member responsible for the error. B. To develop a plan to report the event to regulatory agencies. C. To understand the system failures that led to the error. D. To immediately implement a new hospital-wide policy. Answer: C. To understand the system failures that led to the error. This question focuses on the core purpose of a root cause analysis, where the keyword is primary goal. The main objective of an RCA is to find out why an error happened by looking at broken processes or system flaws, not to place blame on an individual. This approach recognizes that most errors are caused by faulty systems, not bad people. For example, instead of just blaming a nurse, an RCA might find the error was caused by confusing medication labels or a flawed verification process. A great way to remember this is that RCA seeks to fix the system, not punish the person. Question 4. A hospital's quality committee is reviewing different aspects of its emergency department performance. Which of the following is the best example of a structure measure? A. The average time a patient waits to see a physician. B. The percentage of patients who receive a pain assessment within 1 hour of arrival. C. The number of board-certified emergency physicians on staff. D. The rate of patients who leave the emergency department without being seen. Answer: C. The number of board-certified emergency physicians on staff. This question tests the Donabadian model, a framework that evaluates healthcare quality based on structure, process, and outcome. The keyword structure refers to the resources and settings where care is delivered, such as facilities, equipment, and staff qualifications. The number of board-certified physicians is a perfect example of a structure measure because it quantifies the human resources available to provide care. In contrast, wait times and pain assessments are process measures, the how of care, and patients leaving without being seen is an outcome measure, the result of care. For example, the physical number of beds in the department is a structure, while the procedure for assigning patients to those beds is a process. Remember this tip. Structure is what you have to work with, process is what you do with it, and outcome is what happens as a result. Question 5. What is the primary function of a just culture in a healthcare organization's safety program?
A.
To eliminate all consequences for staff who make errors. B. To create a balance between accountability and learning from mistakes. C. To ensure that all errors are reported to the patient's family immediately. D. To focus exclusively on punishing reckless behavior. Answer: B. To create a balance between accountability and learning from mistakes. This question tests the concept of a just culture, and you should focus on the idea of balance. A just culture encourages open reporting of errors by not punishing honest mistakes, which helps the organization learn and improve its systems. However, it also holds individuals accountable for their choices, distinguishing between human error, at-risk behavior, and reckless behavior. For example, accidentally grabbing the wrong medication is a system-related error to learn from, while intentionally ignoring safety protocols is a reckless behavior requiring discipline. The key takeaway is that a just culture is about finding the middle ground between a no-blame and a punitive culture. Question 6. A hospital wants to compare its post-operative infection rate with that of the top-performing hospitals in the country. This process is known as
A.
Root cause analysis. B. Process mapping. C. Benchmarking. D. Failure mode and effects analysis, FMEA. Answer: C. Benchmarking. This question is about the definition of benchmarking, and the clue is compare its rate with that of the top-performing hospitals. Benchmarking is the practice of measuring your organization's performance against the best in the business to identify areas for improvement. It's about learning from others who are doing things exceptionally well. For example, a hospital might discover its infection rate is 5% while the benchmark is 1%, prompting an investigation into the top performers' practices. An easy way to think about it is that benchmarking is like looking at your neighbor's beautiful garden to get ideas for how to improve your own. Question 7. A quality team is using a failure mode and effects analysis, FMEA. The team is primarily focused on
A.
Reacting to an adverse event that has already occurred. B. Identifying what could go wrong with a process before it happens. C. Analyzing the frequency of past patient complaints. D. Determining the financial cost of a quality failure. Answer: B. Identifying what could go wrong with a process before it happens. This question tests the purpose of an FMEA, a key proactive quality tool. The core function of an FMEA is to be proactive, meaning it helps you anticipate potential failures in a process before they ever happen. By identifying what could go wrong, the failure modes, and what the results would be, the effects, a team can build safeguards into the system. For instance, before implementing a new electronic prescribing system, a team would use FMEA to brainstorm potential errors, like selecting the wrong patient or wrong dosage. Remember, FMEA is about preventing fires, while a tool like root cause analysis is about investigating why a fire started. Question 8. In the Plan Do Check Act, PDCA, cycle, what activity occurs during the plan stage?
A.
Implementing the change on a small scale. B. Analyzing data to see if the change was successful. C. Standardizing the solution, if it worked. D. Identifying an opportunity and planning a change. Answer: D. Identifying an opportunity and planning a change. This question is about the PDCA cycle, a fundamental model for improvement, focusing on the plan stage. The plan phase is all about preparation. It's where you define the problem, set goals, and develop a theory on how to make an improvement. All the other answer choices describe activities that happen later in the cycle. For example, if a clinic wants to reduce no-shows, the plan stage would involve researching causes and creating a plan to test a new appointment reminder system. Always remember, the plan stage is where you do all your thinking and preparation before taking any action. Question 9. A nurse uses a run chart to track the number of patient falls on a unit each month for a year. What is the primary information this chart provides?
A.
The main causes of the falls. B. A comparison of fall rates to other hospitals. C. Performance trends or patterns over time. D. The specific patients who fell. Answer: C. Performance trends or patterns over time. This question tests your understanding of a run chart, one of the simplest and most useful quality tools. The key purpose of a run chart is to display data in a sequence over time, which helps you see trends, shifts, or patterns. It doesn't explain why something is happening, but it clearly shows if performance is getting better, worse, or staying the same. For instance, the chart might show that falls have been steadily increasing over the last 6 months, signaling that a problem is growing. Think of a run chart as a simple movie of your data, showing you the story of its performance over time. Question 10. Which of the following is the most reliable method for patient identification to prevent errors?
A.
Asking the patient for their name. B. Checking the name on the patient's door. C. Using at least 2 unique patient identifiers. D. Verifying the patient's room number. Answer: C. Using at least 2 unique patient identifiers. This question is about a critical patient safety practice, and the keyword is most reliable. Using at least 2 identifiers, such as the patient's full name and date of birth, is the standard because it minimizes the chance of mix-ups. Relying on just one piece of information, like a name or room number, is risky because there could be 2 patients with the same name or a patient could be moved to a different room. For example, before giving medication, a nurse should ask the patient to state their full name and birth date and then match that information to their wristband. Remember, 2 checks are always safer than 1 when it comes to patient identity. Question 11. The primary purpose of creating a flowchart before starting an improvement project is to
A.
Identify who is responsible for each step. B. Gain a common understanding of the current process. C. Calculate the time it takes to complete the process. D. Decide which steps of the process to eliminate. Answer: B. Gain a common understanding of the current process. This question asks about the foundational use of a flowchart in quality improvement. A flowchart's main purpose is to create a visual map of all the steps in a process, ensuring everyone on the team sees and understands it the same way. This shared understanding is a critical first step before you can analyze or improve anything. For instance, a team trying to improve patient discharge might discover through a flowchart that there are many redundant or confusing steps no one was aware of. Think of a flowchart as the "you are here" map for your process. You have to know where you are before you can plan a new route. Question 12. A sentinel event in a healthcare setting is best defined as
A.
Any error that reaches the patient, regardless of harm. B. An unexpected occurrence involving death or serious injury. C. A minor complaint from a patient or family member. D. A near miss that was caught before it reached the patient. Answer: B. An unexpected occurrence involving death or serious injury. This question tests the specific definition of a sentinel event, a critical patient safety term. The key elements are that the event is unexpected and results in death or serious physical or psychological injury, or the risk thereof. It represents the most serious level of patient safety failure and requires immediate investigation. For example, surgery performed on the wrong body part is a classic sentinel event. An easy way to remember it is that a sentinel event acts as a sentinel or guard, sending a loud warning signal that a deep system problem must be fixed immediately. Question 13. A quality leader's most important role in fostering a culture of quality and safety is to
A.
Personally conduct all root cause analyses. B. Ensure the organization's vision and resources support quality goals. C. Review every patient complaint form herself. D. Punish staff who do not follow quality protocols. Answer: B. Ensure the organization's vision and resources support quality goals. This question is about the role of leadership in quality, and the keyword is most important. While all options relate to quality, A leader's primary role is strategic, to set the vision, communicate the importance of quality, and provide the necessary resources, like time, training, and tools, for staff to succeed. This high-level support is what enables the entire culture to shift towards quality. For instance, if leadership consistently talks about safety and budgets for safety training, employees will understand it is a true priority. Remember, a leader's job is to steer the ship and provide the map, not to row the boat themselves. Question 14. A hospital is analyzing data on the length of stay for pneumonia patients. Since length of stay can be measured and can have fractional values, for example, 3-5 days, it is considered what type of data?
A.
Attribute data. B. Nominal data. C. Ordinal data. D. Continuous data. Answer: D. Continuous data. This question tests your knowledge of basic data types, a key concept for measurement in healthcare. Continuous data is anything that can be measured on a scale and can take on any value within a range, including fractions or decimals. Attribute data, on the other hand, is for things you can only count in whole numbers, like the number of patient falls or whether a procedure was done correctly, yes/no. For example, a patient's height, weight, and temperature are all continuous data because they can be measured with great precision. A simple tip is to ask yourself, can I measure this in fractions? If yes, it's likely continuous data. Question 15. The main benefit of receiving accreditation from an organization, like the Joint Commission, is that it
A.
guarantees the hospital will never have a medical error. B. Provides a framework for quality structures and demonstrates a commitment to patient safety. C. Allows the hospital to charge higher prices for its services. D. Fulfills all state and federal legal requirements for operation. Answer: B. Provides a framework for quality structures and demonstrates a commitment to patient safety. This question asks about the primary value of accreditation in healthcare. Accreditation's main purpose is to signal to the public that a hospital meets a high standard of quality and safety as verified by an independent body. While it helps with legal and payment requirements, its core benefit is driving the organization to use proven quality improvement structures and processes. For example, preparing for an accreditation survey forces a hospital to review all of its safety protocols, from hand hygiene to medication management. Think of accreditation as a good housekeeping seal of approval for a hospital, showing it is committed to excellence. Question 16. During a team brainstorming session to find solutions for a problem, what is the most important rule to follow?
A.
Criticize ideas immediately to save time. B. Generate as many ideas as possible without judgment. C. Only allow senior staff members to contribute ideas. D. Stop after the first good idea is suggested. Answer: B. Generate as many ideas as possible without judgment. This question is about the fundamental principle of effective brainstorming. The most critical rule is to encourage a free flow of ideas by deferring all judgment and criticism until later. The goal is quantity over quality in this initial phase, as even a seemingly wild idea can spark a practical solution from someone else. For instance, when trying to improve hospital food, ideas might range from hire a celebrity chef to change the salt shakers, and all should be written down without comment. The key takeaway is to separate the act of creating ideas from the act of evaluating them. Question 17. An improvement team creates a diagram with a central line and branches labeled people, process, equipment, and materials to explore potential reasons for a problem. This tool is known as a flowchart, B. Pareto chart, C. Control chart, D. Cause and effect diagram. Answer: D. Cause and effect diagram. This question tests your ability to identify a common quality tool by its description. A cause and effect diagram, also known as a fishbone or Ishikawa diagram, is a tool used to brainstorm all the potential causes of a specific problem. It organizes these potential causes into categories, like the ones mentioned in the question, to ensure a thorough exploration. For example, if the problem is delayed lab results, the team would brainstorm causes under categories like equipment, for example, slow centrifuge, or people, for example, short-staffed. Remember it by its nickname. The diagram looks like a fish skeleton, with the head being the problem and the bones being the causes. Question 18. The main purpose of a healthcare organization's risk management program is to
A.
Purchase insurance to cover all potential lawsuits. B. Discipline employees who are involved in patient incidents. C. Identify, evaluate, and control risks to prevent harm to patients and staff. D. Respond to patient complaints about customer service issues. Answer: C. Identify, evaluate, and control risks to prevent harm to patients and staff. This question focuses on the core function of risk management in a healthcare setting. A risk management program's primary goal is to proactively protect patients, staff, and visitors from accidental injury and the organization from financial loss. This involves systematically looking for potential dangers, figuring out how serious they are, and then taking steps to minimize or eliminate them. For example, a risk manager might notice a high number of falls in one hallway and take action to improve the lighting and flooring there. A good way to remember this is that risk management is all about preventing harm before it happens. Question 19. A hospital statement. To be the leading provider of compassionate, patient-centered care in our community is an example of A. Vision statement. B. Mission statement. C. Strategic goal. D. Financial objective.
Answer: A.
Vision statement. This question tests your ability to distinguish between key strategic planning terms. A vision statement is aspirational and describes what an organization wants to become in the future. It's the ultimate goal or the big dream. A mission statement, in contrast, typically describes the organization's current purpose, who it serves, and what it does. The phrase, to be the leading provider, clearly points to a future aspiration. For example, a mission might be to provide high-quality healthcare, while the vision is to be the best hospital in the state. Think of the vision as your destination and the mission as the car you're driving to get there. Question 20. The core principle of the Six Sigma methodology is to
A.
Remove non-value-added steps from a process. B. Improve quality by reducing variation and defects. C. Empower frontline staff to make immediate process changes. D. Compare performance against best-in-class organizations. Answer: B. Improve quality by reducing variation and defects. This question is about the central goal of the Six Sigma improvement model. The main focus of Six Sigma is to achieve nearly perfect processes by identifying and eliminating the causes of defects or errors, thereby minimizing variation. While other options are good quality practices, Six Sigma is uniquely defined by its rigorous, data-driven approach to reducing variability. For instance, a Six Sigma project might aim to reduce medication errors to a rate of less than 3-4 per million opportunities. The key takeaway is that Six Sigma is all about achieving consistent, predictable, and defect-free results. Question 21. A quality professional is using a simple tally sheet to record the number of times different types of errors occur during patient registration. This data collection tool is called a histogram. B. Check sheet. C. Control chart. D. Scatter diagram. Answer: B. Check sheet. This question asks you to identify a basic data collection tool from its description. A check sheet is a simple, pre-structured form used to collect and tally data in real time as it's observed. It's a low-tech but effective way to gather frequency data on events, like a coach making a tick mark every time a player makes a free throw. For example, a registration clerk could use a check sheet with columns for missing insurance info, incorrect address, and wrong phone number to track common errors. Just remember, a check sheet is for the simple act of checking off and counting occurrences. Question 22. What is the primary purpose of obtaining informed consent from a patient before a procedure?
A.
To protect the hospital from all potential lawsuits. B. To ensure the patient has received and understood information about their treatment options. C. To provide the billing department with the necessary codes for the procedure. D. To confirm that the patient has adequate insurance coverage. Answer: B. To ensure the patient has received and understood information about their treatment options. This question focuses on the ethical and legal principle of informed consent. The main goal of informed consent is to respect a patient's autonomy by making sure they have all the critical information, including the risks, benefits, and alternatives, needed to make a voluntary decision about their care. While it has legal implications, its primary purpose is centered on patient understanding and rights. For example, a doctor must explain not just what a surgery involves, but also what could go wrong and what other non-surgical options exist. A key tip is to remember that informed is the most important word. The process is about ensuring genuine understanding, not just getting a signature. Question 23. A control chart shows 7 consecutive data points all trending steadily upward, but still within the upper and lower control limits. This pattern most likely indicates
A.
The process is stable and in control. B. A special cause is influencing the process. C. The data was collected incorrectly. D. The control limits are too wide. Answer: B. A special cause is influencing the process. This question tests a basic rule for interpreting control charts, focusing on the clue, 7 consecutive data points all trending steadily upward. Even if the points are within the control limits, a non-random pattern like this, a run, is a signal that something specific and out of the ordinary, a special cause, has entered the process and is causing a shift. A stable process should have data points that bounce around randomly within the limits. For instance, if a lab's test turnaround times trend up for 7 straight days, it could signal a new, untrained technician or a failing piece of equipment. Remember, on a control chart, not just big jumps but also unusual patterns are important signals of a problem. Question 24. The main goal of the lean methodology in healthcare is to
A.
Increase the number of services offered to patients. B. Maximize value for the patient by eliminating waste. C. Implement the latest medical technology. D. Hire more staff to reduce workload. Answer: B. Maximize value for the patient by eliminating waste. This question asks for the central principle of the lean improvement philosophy. Lean is all about creating more value for the customer, the patient, with fewer resources by relentlessly identifying and eliminating waste. Waste is defined as any step in a process that does not add value from the patient's perspective. For example, making a patient walk to 3 different departments for registration, testing, and consultation is waste that lean would seek to eliminate by creating a one-stop shop clinic. A simple way to think about lean is more value, less waste. Question 25. Which of the following is the best example of a quality indicator?
A.
The number of beds in the intensive care unit. B. The percentage of patients who develop an infection after surgery. C. The annual budget for the nursing department. D. The hospital's mission statement. Answer: B. The percentage of patients who develop an infection after surgery. This question tests your ability to identify a valid quality indicator. A quality indicator is a specific, measurable item that gives you information about the quality of care, allowing you to track performance and identify potential problems. The percentage of patients who develop a post-surgical infection is a direct measure of a healthcare outcome and is a classic example of a quality indicator. The other options describe resources or statements, not a measure of care quality. For instance, hospitals track this indicator very closely to see if their infection control practices are working. Remember, an indicator is a signpost that indicates the level of quality. Question 26. In a quality improvement team, the facilitator's primary role is to
A.
Be the expert on the topic being discussed. B. Make the final decisions for the group. C. Manage the team process and encourage participation from all members. D. Take detailed minutes and distribute them after the meeting. Answer: C. Manage the team process and encourage participation from all members. This question is about understanding team roles, specifically that of the facilitator. The facilitator's main job is to focus on the how of the meeting, the process, rather than the what, the content. They guide the discussion, ensure everyone contributes, manage conflict, and keep the team on track without pushing their own opinions. For example, a facilitator might say, "We've heard from a few people, but I'd like to hear what others think." To encourage broader participation, think of a facilitator as the neutral referee of a game, ensuring fair play and keeping the game moving smoothly. Question 27. When a hospital's performance on a quality measure is compared to its own past performance, this is known as
A.
External benchmarking. B. Internal benchmarking. C. Competitive benchmarking. D. Functional benchmarking. Answer: B. Internal benchmarking. This question distinguishes between different types of benchmarking, with the key phrase being compared to its own past performance. Internal benchmarking is the process of tracking your own performance over time to see if you are improving. This is different from external benchmarking, where you compare yourself to other organizations. For example, an emergency department might track its door-to-doctor time each month to see if its improvement efforts are paying off. An easy way to remember is that internal means you are looking inside your own organization for comparison. Question 28. A histogram is a type of bar chart that is used to display
A.
Performance of a measure over a period of time. B. The relationship between two different variables. C. The frequency distribution of data. D. The proportion of parts to a whole. Answer: C. The frequency distribution of data. This question tests your knowledge of what a histogram is used for in data analysis. A histogram's unique purpose is to show how often different values in a set of continuous data occur, revealing the data's shape, center, and spread. Unlike a simple bar chart, the bars in a histogram represent ranges of data and are typically shown touching each other. For example, you could use a histogram to show the distribution of patient ages, with bars for age ranges like 0 to 10, 11 to 20, 21 to 30, and so on. Think of a histogram as a snapshot that shows you the shape of your data. Question 29. A never event is a serious medical error that is
A.
Likely to happen at least once per year. B. Usually caused by patient noncompliance. C. Considered largely preventable and should never occur. D. A minor error that does not cause patient harm. Answer: C. Considered largely preventable and should never occur. This question asks for the definition of a never event, a specific category of medical errors. Never events are serious, often devastating, and clearly identifiable patient safety incidents that should be entirely preventable with the use of existing safety guidelines. They are considered so unacceptable that they should, as the name implies, never happen. A classic example is surgery on the wrong patient or wrong body part. A simple way to remember this is that these events are so egregious and preventable that their occurrence is a red flag for major system failures. Question 30. The primary purpose of a hospital's credentialing process for physicians is to
A.
Determine the physician's salary and benefits package. B. Verify the physician's qualifications, training, and competence. C. Assign the physician to a specific hospital department. D. Provide the physician with a parking pass and hospital ID. Answer: B. Verify the physician's qualifications, training, and competence. This question is about the fundamental purpose of medical staff credentialing. The credentialing process is a critical safety function where the hospital meticulously checks a doctor's background to confirm they have the required license, education, training, and demonstrated competence to provide quality patient care. It's about ensuring that every provider allowed to work in the facility is qualified and safe. For example, this process involves checking with medical schools, previous employers, and national databases to verify a surgeon's history. Remember, credentialing is the formal process of giving a provider credentials to prove they are qualified for the job. Question 31. A quality team wants to compare their current process performance against the desired best practice performance to identify what needs to be improved. This activity is called A. Root cause analysis. B. Gap analysis. C. Force field analysis. D. SWOT analysis. Answer. B. Gap analysis. This question tests your understanding of a common strategic planning tool, with the keyword being compare, current, against the desired. A gap analysis is a straightforward method for identifying the gap between where you are now, your current state, and where you want to be, your future or desired state. This process helps you pinpoint the specific areas you need to focus on to achieve your goals. For instance, if your goal is a 95% patient satisfaction rate and your current rate is 80%, the 15% difference is the gap you need to address. Think of it as minding the gap between your reality and your goal. Question 32. Protecting a patient's private health information is a core requirement of which regulation?
A.
EMTLA, Emergency Medical Treatment and Active Labor Act. B. HIPAA, Health Insurance Portability and Accountability Act. C. HITECH, Health Information Technology for Economic and Clinical Health Act. D. OSHA, Occupational Safety and Health Administration. Answer. B. HIPAA, Health Insurance Portability and Accountability Act. This question tests your knowledge of major healthcare regulations, focusing on the protection of private health information. The HIPAA privacy rule established national standards to protect individuals' medical records and other personal health information. While other regulations are important for other areas of healthcare, HIPAA is the one most directly associated with patient confidentiality. For example, HIPAA rules are why a nurse cannot discuss a patient's condition in a public elevator or leave records visible at the nurse's station. A good tip is to associate the P in HIPAA with privacy. Question 33. The HCHPS, Hospital Consumer Assessment of Healthcare Providers and Systems, survey is designed to collect patient perspectives on
A.
the cost of their hospital care. B. the quality of the hospital food. C. their experience of care, including communication and responsiveness. D. the doctor's medical school credentials. Answer. C. their experience of care, including communication and responsiveness. This question is about the purpose of the HCHPS survey, a standardized tool used across the United States. The survey's goal is to gather the patient's perspective on key aspects of their hospital stay, focusing on topics like how well nurses and doctors communicated, how responsive staff were, and how clean the environment was. It is not about the cost or technical skill, but about the patient's actual experience of care. For example, one question asks patients how often their pain was well controlled. Remember that HCHPS is all about seeing the hospital experience through the patient's eyes. Question 34. What is the main drawback of using brainstorming to generate a list of potential solutions?
A.
It is a very slow and time-consuming process. B. It requires a highly trained expert to facilitate. C. A few vocal individuals may dominate the discussion. D. It rarely produces creative or innovative ideas. Answer. C. A few vocal individuals may dominate the discussion. This question asks about a common challenge in brainstorming, making you think critically about the tool's weaknesses. While brainstorming is great for generating many ideas quickly, a significant risk is that one or two outspoken people can control the conversation, preventing quieter members from sharing their thoughts. This can limit the diversity of ideas and lead to groupthink, where everyone just agrees with the dominant voices. To counter this, a good facilitator will use techniques like a round robin where everyone gets a turn to speak. Remember, for brainstorming to be truly effective, you must ensure all voices are heard. not just the loudest ones. Question 35. When a quality team is creating a flowchart, a diamond-shaped symbol is traditionally used to represent
A.
the start or end of the process. B. a step where an action is taken. C. a point where a decision must be made. D. a document or report. Answer: C. a point where a decision must be made. This question tests your knowledge of the standard symbols used in flowcharting. The diamond shape is universally used in process mapping to indicate a decision point, typically a step that has a yes or no answer, which then leads to different paths. For example, in a flowchart for a patient call center, a diamond might contain the question, is the caller an existing patient? With a yes arrow going to one step and a no arrow going to another. A helpful way to remember this is that a diamond has sharp points, just like a decision point that directs the flow in different directions.